Hey guys, this is Taylor with SoCal EMS Training Institute. In this video, we're going to be going over a whole medical assessment. We'll get started. BSI scene safety, Penman, personnel safety, I'm safe. Any environmental hazards, as of right now, there are none. Number of patients, we have one patient. Mechanism of injury or nature of illness, call comes in as chest pain. Additional resources, we're going to make sure ALS and fire is on its way. And as of right now, there's no need for extrication or C-spine. My general impression, I see approximately 50-year-old male sitting at home on the couch. His wife let me into the door. Hello sir, my name is Taylor, I'm an EMT. What's your name?
My name's Tyler.
Alright Tyler, what's your last name, Tyler?
Last name's Andrews.
Okay. Do you know where you are right now?
Yeah, I'm at home.
You're at home? Okay. And what year is it right now?
It's 2020.
Okay. And why are we here today? Why did you call 911?
My chest is hurting really bad.
Okay, you're having chest pain?
Yeah.
Okay, alright. Right now my patient is ANO times 4. He is alert and oriented completely. From here we're going to check our airway. It is open, clear, maintainable since he is talking with me. My breathing, I'm going to look at the rate, tidal volume, and effort. I'm going to say he's approximately breathing 20 breaths per minute as of right now, full and effective. So we'll hold off on O2. His pulse, sir, I'm going to take your pulse, okay? Right now, I'm going to look for his pulse, which is going to be rate, rhythm, and quality. It's around 100, strong and regular. I'm going to feel his skin color, moisture, temperature. So with this patient, we're going to say he's pale, cool, and diaphoretic, and I don't see any major bleeding. Since he is pale, cool, and diaphoretic, I would have my partner start 15 liters per minute via non-rebreather. Let's get him on some oxygen. All right.
Oh, thank you.
So in this situation, we're just going to have him hold it there. That way you guys can hear him and he can talk. All right. So now that we've got him on O2, we're not going to lay him down as of right now since he's talking with us, but we would make sure that we're going to keep him warm. I'm going to decide this is a medical patient. He is critical since he's complaining of chest pain. So we're going to end up loading and going after we get a set of vitals and ask him a few more questions. So now that I'm done with my primary assessment, I'm going to have my partner get a full set of vitals. I want to get a blood pressure, a pulse, respirations. Let's get his eyes. Let's get some good lung sounds. We're also going to get his skin signs again, SpO2, and I'm going to have my partner let me know when he's got that. All right. So, sir, we're going to ask you a couple questions, okay? With this chest pain, you said you're having a pain in your chest, correct?
Mm-hmm.
Okay. Did this pain come all of a sudden, or was it kind of a gradual onset?
No, it came on all of a sudden.
All of a sudden,
Mm-hmm.
okay. What were you doing when this pain started? What was going on?
I was just sitting on the couch. My wife and I were watching some TV.
Okay.
Mm-hmm.
Does anything make it better or worse?
No, not really. It just kind of hurts.
Okay.
Mm-hmm.
Can you describe the chest pain for me?
It feels like it's like really heavy. It feels like maybe somebody's sitting on my chest.
So it feels like someone's sitting on your chest?
Mm-hmm.
Okay. With one finger, actually go ahead and lift up your shirt for me. With one finger, point to where your pain is.
It's like right here in the middle.
Right there. Does it move anywhere else?
It kind of goes up to my left shoulder,
Your left
my
shoulder?
neck a little bit.
Okay.
Mm-hmm.
All right. I'm going to feel your chest, okay?
Okay.
All right. Does it hurt right there?
No, not
Doesn't
when
really
you push
hurt when I
on
push
it.
on it? No?
Mhm.
But it goes up to your shoulder?
Yeah.
No? Okay. All right. On a scale of 1 to 10, 10 being the very worst pain you've ever had in your life, what would you rate your pain?
I'd say it's an 8.
An 8 right now? Okay.
Yeah.
Has that stayed an 8, or was it better or worse
It
throughout
came
this
on
time?
as an 8, and it's been an 8 the whole time.
Okay.
Mhm.
Right now it's 11:30. How long has this been going on for?
Maybe 15, 20 minutes.
Okay.
So maybe just before 11 o'clock.
Okay. All right. As of right now, my partner should be done with his vital signs, so I'm going to get a blood pressure. Let's say his blood pressure is 140/90. His pulse is still around 100, strong and regular. He's breathing right now at 20 breaths per minute, full and effective. Let's say that his color, moisture, temperature is still pale, cool, and he's no longer sweating. My SpO2 is going to be 99%. Lung sounds are going to be clear bilateral, and my eyes are pearl. So now that I've got my blood pressure and my full set of vitals, I'm going to continue on with my assessment. So, sir, do you have any medical history?
Yeah, I've had a heart attack in the past.
Okay. Do you have any allergies to any medication?
I'm allergic to peanuts.
Allergic to peanuts? Okay, but no medication?
No.
No? And are you currently taking any medication? Or are you prescribed any medication?
I take an aspirin every day, and then my doctor prescribed me this nitroglycerin.
Okay. Have you taken either of those, aspirin or nitro, today?
I forgot to take my aspirin this morning, so no, and I haven't taken any nitroglycerin.
Okay. What was the last thing you ate today?
We had breakfast this morning. It was scrambled eggs and some toast.
Okay. And what were you doing? You said you were just watching TV with your wife, and all of a sudden this chest pain had started. Yep.
Yeah.
Okay. Now, you did say that you have history of heart issues. Can you describe that a little bit for me?
Yeah, I had a heart attack about 3 years ago.
Okay.
And since then, my doctor prescribed me the nitroglycerin.
Okay.
And told me to eat better and exercise.
Okay. All right. So 3 years ago, you had a heart attack.
Yeah.
Does this feel like the same thing that's been going on?
Kind of similar, yeah, now that you mention it.
Okay. All right. So right now, what we're going to do, we're going to treat this patient. Since he is prescribed nitroglycerin, we're going to check that nitroglycerin, and we're going to assist the patient in taking that. So when we look at our nitroglycerin, we're going to write and dice our medication. So we're going to make sure that we have the right drug, which is nitroglycerin. Indications: this patient is having substernal chest pain related to potential cardiac issue related. Clarity: we have good clarity. It expires 09/2022, and we have good writes and dice. Indication, clarity, expiration, and integrity of this drug. We're going to make sure it's a right patient who's complaining of chest pain and it's prescribed this nitroglycerin. So we're going to make sure that he has a name to this nitroglycerin. We're going to make sure it's the right dose, which is going to be 0.4 milligrams sublingual. We're going to start off with 1 spray. And with this patient, we're going to assist with this patient, okay? At this time, we could have my partner contact medical control or direction and ask them about this medication and confirm that we can give this patient and assist with this patient, okay? So with this, what we're going to do is we're going to assist this, okay? Sir, have you taken any erectile dysfunctioning drugs within the last 48 hours?
No.
No? Okay. All right. And you're not allergic to any drugs?
Just peanuts.
Just peanuts, okay. All right, so go ahead and hold this.
Okay.
Just like normal, what we're going to do is you're going to open up your mouth, you're going to spray it underneath your tongue, okay? All right, go ahead. All right. So that's our first dose, which is going to be at 11:34. From here, we're going to give them aspirin. Again, we're going to write and dice our drug. So we got the right drug, which is aspirin. We got the right dose, which is going to be a total of 324 milligrams. We got the right indication: the patient is having chest pain, suspected cardiac issue. We have the right clarity. There's nothing wrong with this. We have the right integrity. It is not expired. We have the right patient. We're going to confirm he has no allergies. He does not. And you have not taken any aspirin, correct?
No.
Okay. From here, we're going to give him 4 tablets. We're going to have him chew this. So, sir, what you're going to do is you're going to chew these up,
Okay.
and you're going to swallow it, okay?
Thank you.
Okay. So right now, this is where we're going to reassess our patient. We did have a good blood pressure of 140/90. Let's make sure we get another blood pressure since we gave him nitroglycerin. So right now, my partner just got that. Our updated BP comes back 120/60, okay? From here, we're going to ask ask a little bit more questions on his chest pain. So, sir, you said it was an 8 out of 10 on the pain scale. Right now, after a few minutes taking that nitroglycerin, what is your pain?
It's like a 3.
You have a 3 right now? Okay, so it's working.
Yeah.
Very good.
The medicine seemed to help. Thank you.
Okay, good. So right now, since we got most of our pertinent questions and answers, we can load this patient up on the gurney. We're going to get him over to the hospital. We're going to reassess vital signs every 5 minutes since he is critical. We're going to reassess our vital signs. We're going to keep on asking him questions. And we can also, as well, do another dose of nitroglycerin as long as his pain is at a 3. We just want to be careful of our BP. From there, that's about it. Thanks guys for watching. Again, this is your medical assessment with SoCal EMS Train Institute.